So picture this. A country is about to take a huge step forward on the world stage. It's a moment of national pride, right? But what if that exact same step forward could actually push its people's health backward? That's the fascinating puzzle we're looking at in Nepal today. Let's get into it.
All right, the year to remember is 2026. That's the big one. It's when Nepal is scheduled to graduate from its status as a least developed country. Now, this is a huge deal, a real badge of honor showing just how far they've come. But it also starts a ticking clock, a countdown that could totally reshape their entire healthcare system.
And that brings us to the core question here, right? Is this graduation simply a moment of national progress, or is there a looming healthcare crisis hiding just under the surface? The answer, as you might guess, isn't so simple. And to really get it, we need to talk about a special advantage Nepal has had for a long, long time. Okay, so to really unpack what's at stake, we've got to start with this unique medical advantage Nepal has enjoyed, all thanks to its status as what's called a least developed country, or LDC for short. So what exactly is an LDC? Well, it's a designation from the UN for countries with the lowest levels of socioeconomic development. And with that status comes some special perks, trade benefits to help them grow. And a really, really important one of those perks is an exemption from certain global trade rules. And here's the key benefit, the one that matters most for this story. Under a big World Trade Organization agreement, Nepal hasn't had to enforce patents on pharmaceuticals. Think about that for a second. It means local companies could look at almost any medicine in the world and say, we can make a generic version of that. It's been a total game changer for them. I mean, just look at the difference this makes. Before 2026, as an LDC, they can produce affordable generic versions of pretty much anything. It's a free-for-all for local drug makers, which means lower medicine costs for everybody. But after 2026, everything changes. They'll have to enforce patents, local production of new drugs could get blocked, and there's a real risk that drug prices could skyrocket. This isn't just some legal fine print. It's a massive shift. Okay, so let's shift gears and talk about the people this actually affects. Because over the last 30 years or so, the kinds of health problems people in Nepal are facing have completely flipped on their head, which makes this whole patent issue so much more urgent. Just take a look at this. Back in 1990, the top causes of death were things like lower respiratory infections and diarrheal diseases, communicable stuff. But fast forward to 2017, and what do you see? Ischemic heart disease, COPD. These are non-communicable diseases, or NCDs. We're talking about a huge fundamental change in the public health landscape. And this is where our two storylines crash into each other. The problem is the newest, most effective treatments for these NCDs, for things like heart disease and cancer, are almost always the ones that are still under patent, the very patents that Nepal will soon have to start enforcing. Now, let's talk about money. Who actually pays for healthcare in Nepal? Well, this chart is pretty eye-opening. A whopping 55% of all health spending is paid for out of pocket. That means people are digging into their own savings to pay for medicine and care. The financial burden is already huge, so you can imagine if drug prices suddenly jump up, it could be absolutely catastrophic for families. All right, so with all that in mind, let's zoom in on the industry that's been at the center of keeping medicines affordable for so long, Nepal's very own local pharmaceutical companies. And make no mistake, these local drug companies are a big deal. They supply almost half, about 45%, of the entire country's medicine market by value. This isn't some small-time operation. We're talking about a major pillar of their national health system. And this quote from a senior exec at a Nepali drug company really hits the nail on the head. He says, "These new drugs have kept us growing. These new drugs have quickly come to account for between 15 to 20% of my unit's annual sales." So you see, making these newer generic drugs hasn't just been a nice little bonus for them. It's been the engine of their growth. So that engine of growth we just talked about, the one that's been so crucial, well, that's exactly what's at risk of being shut down. But it doesn't have to be a doomsday scenario. There are actually tools they can use to navigate this. And that brings us to the solutions, because here's the interesting twist. The very same international agreement that's causing this problem also contains the solutions. It's like it has a built-in public health safety net. These tools are called TRIPS flexibilities.
It's a bit of a technical term, but all it really means is a set of legal options and safeguards that let countries put public health first when they're writing their own patent laws. It's like a toolbox of safety valves designed for exactly this kind of situation. So, what's in this toolbox? Well, first off, they can set really strict patent rules, so they're only granting patents for actual genuine innovations, not just for tiny tweaks to old drugs. Second, they can use something called compulsory licensing. This is a big one. It means the government can basically say, hey, there's a health crisis, so we're authorizing a local company to make a generic version of this patented drug. They can also allow for parallel imports, which just means bringing in a cheaper version of a patented drug from another country where it's sold for less. And finally, there are research exceptions that let generic companies get a head start on development before a patent even expires. These are all really powerful, proactive steps they can take.
But here's the catch. This toolbox is there, but it's not automatic. You have to actually use the tools. Getting ready for 2026 means Nepal needs a really clear, coordinated plan, and they need to start putting it into action like yesterday. So the path forward looks something like this. The government's job? To get all of those TRIPS flexibilities written into their national laws and to build up the expertise to actually review patent applications properly. The industry's job? To squeeze every last drop out of the time they have left under the old system while getting ready for the new one. And civil society, advocacy groups, and the public. They have a massive role to play in pushing for a system that always puts public health first. It's truly an all-hands-on-deck situation. And all of this really leaves us with a much bigger, more universal question, doesn't it? Nepal's challenge is really just a snapshot of a global dilemma. How do we balance the need for medical innovation, which patents are supposed to encourage, with every single person's right to affordable care? I mean, what good is a miracle cure if nobody can afford it? That's the question Nepal is being forced to answer right now, and frankly, it's one the entire world is still wrestling with.